Oh, thank you so much, Assemblywoman Davies. It's such a pleasure to be here and to be part of this such an important discussion about youth mental health. Next slide, please. So what I'm going to do is I'm going to talk about, as Dr. Husty mentioned, we'll talk about specific with regard to the different tiers, the foundation of prevention and targeted intervention. And I know that a lot of the questions were geared specifically for how can I access resources? So that's sort of how I'm going to focus on specific ways that you can access resources for children, specifically in Orange County, all over the county, and then some sort of plug and play, if you will, resources that are available. And I know that Heather Husty did a really good job of describing that top tier of really intensive services that are available, outside of outpatient or up to the point of outpatient. And that's really, again, when we're talking about outpatient, it's for those kids that we talked about that she referred to, of like the stadiums full of children that have diagnosable mental health disorders. And so when we look at the resources that are available, it's like these are like entry points into the children's system of care, children and youth here in Orange County. And we have opportunities to help navigate through the system of mental health care for children. And one of the things that we know is that, it's really sometimes difficult to take that first step. And when you run into a barrier of asking for help and you don't know which phone number, you don't know who to call, what we found is that we have access coordinators here at Western Youth Services that will answer the phone, answer the email, and literally help navigate and provide and direct and link into specific, very precise services that are available. We're not a crisis hotline, so if your child is in crisis, do everything that Dr. Husty just said to do. But if you have questions about it, and it's for any Orange County resident in Orange County, we have an outreach and engagement program. Specifically, it's located in Mission Viejo, but we are literally out in the community. When the community opens up, we'll be out there even more. But we're on school campuses when they're open. We're in food distribution lines at schools for the reduced lunches, handing out these flyers saying, here's how you can access some of these resources. So you have the contact information there. It's a toll-free number. Email us at info@westernyouthservices.org. And what this is again, the skills-based, solution-focused services when you suspect that your child or a child in your care is experiencing some emotional distress, and certainly now, as we've seen with COVID, more than anything, like the acuity level is so much higher. So it's really, when in question, just give us a call. So what we offer at Outreach and Engagement is we have trained professionals, licensed counselors that provide short-term therapy. What that means is anywhere from 1 to maybe 6 sessions at the most to get over, to learn skills, new skills. They're maybe related to grief and loss, or learning coping skills to deal with minor levels of anxiety, those kinds of things that'll respond to short-term therapy. And if you don't know if they will or won't respond, still access the resources anyway, because we will do the linking to other resources. So again, this is for any Orange County, South County resident. Can call this number. If you have insurance, we'll help link you to the resources that are available through your insurance company, all of that. Let us help navigate through the system with you. So there are also skills-based groups and one-on-one skill building, educational workshops that are available to teachers and other professionals, but also parenting skills, how to deal with youth's anxiety as a parent, and things of that nature, where if you're just wanting to build certain skills in this area, again, we have those educational workshops as well. So the referral, linkage, and resource navigation is what I was referring to, where we have someone who's like an access coordinator that are going to identify what's the appropriate referral. And this isn't just for mental health care, because what we also know is that some of those economic and other contributing factors that kind of go along with depression and anxiety and things of that nature. Sometimes when we solve different kinds of problem, like access to childcare or access to emergency resources, like emergency funding for an electric bill or things of that, sometimes just dealing with those economic things and helping navigate that system will actually have a positive impact on the mental health and well-being as well. So we have the referral list and linkage and resource and help navigate. And then we also have outreach events. Again, when we open up, these will be more, but outreach and events in the community, that means we go to places where people are naturally congregating and offer our resources in education and letting people know how to build resilience. What, you know, in my bio, we talked about adverse childhood experiences, ACEs. Those are traumatic events related to abuse, neglect, family dysfunction, and other related life events that we know are associated with the onset of depression, anxiety, and post-traumatic stress disorder. So we talk about how to recognize those and what things we can do immediately in the lives of children and families to help reduce that stress that's associated with adverse childhood experiences and the related life events and things that are really impacting you know, the stress response. So we have these outreach events that are really, again, tied to identify what are some of the prevention efforts that are underway that where we're looking at it like, you know, we have those stadiums full of children that have diagnosed mental health condition or diagnosable mental health disorders. What we're doing is we're approaching it also from the prevention side and then coordinating efforts with Chalk Hospital and others that are providing those intensive services that are so needed when kids are in crisis and things of that nature. So this outreach and engagement, again, is available to all South County residents, and that's our contact information. Next slide, please. So we have another program, and this is for any CalOptima member. So what we, again, have determined that it's way easier if you have one point of entry into the healthcare system, and then let us help navigate. So for any child, any family that is a CalOptima member, where we are connecting children to CalOptima mental health services through one simple phone call. So if you have CalOptima or you know of someone and you're trying to help them navigate, you see that the provider book is like a phone book and there's like hundreds of providers, but you don't know which ones are accepting referrals, which ones see children, which ones have expertise in a particular area. We've done all of that work for you. And so there's one toll-free number and one email. Again, easy access info@Western Youth Services. This is a different number than the South County residents. This is for CalOptima members only. And so basically what we're doing when we're talking about mental health access coordination, what we're talking about is coordinating access to that first appointment with a CalOptima mental health provider. And we also provide mental health screening. So on that first call, we'll be doing a screening to assess what level of support and treatment is needed during that call. And if we do notice that you need a higher level of care than outpatient, that's when we do the linkage and referral into a higher level of care, which may be Chalk. We find the best provider for your child. Again, we've vetted and we have personal relationships with many of the people who are on the provider list, because we know which ones are currently taking referrals, which ones are treating children. We've again done all of that that legwork for you to do that. So we're also in this program, we problem solve through the barriers to get you connected to providers. Sometimes there's language needs, sometimes there's a specific access need, and so we navigate that for you, and we stay involved until the child is connected to the resources. So we have an ongoing list where we're making sure that children are connected. It isn't just call this number, it's actually a warm handoff to a referral. And again, this is for any CalOptima member. And I see questions in the chat, and I'm going to keep going, and I'll get to those at the end. But this is again for CalOptima members. There's a toll-free number specifically for this. We call it CMHA. We use a lot of acronyms, but basically it's a one-door access, one door to get into access to mental health services for kids that have CalOptima. Next slide, please. Now, the other thing that I'm really, really proud to say that this is, the Reset Toolbox is a collaboration with CHOC and the Orange County Department of Education, along with a lot of other resource providers. And the way this Reset Toolbox, like the thought of it, was right at the beginning of COVID and right at the beginning of the shutdown of schools. There were a number of psychologists in the county putting our heads together saying, we already know that there's going to be mental health implications because of this pandemic. And so we were thinking ahead and saying, how can we prevent the onset, if we can, of PTSD and some of those other traumatic reactions as a result of this. And back a year ago when we were thinking about it, we had no idea that it was going to go on for over a year. And what we did is we built this infrastructure, this Reset Toolbox, and its resilience, essential social emotional training toolbox that has tons of resources for live trainings, pre-scheduled trainings, and there's a ton of topics, and the trainings are for community, consumers in the community, students at different ages, parents, teachers, school administrators. And basically what we've done is we've vetted hundreds of resources that have been available out there, everything from Sesame Street to resources that are provided and available at Yale, for resilience building. And we've really put them all together into this Reset Toolbox. That's the website there. And there are no cost, there's no cost to any of these trainings. And one of the things I know that one of the questions that's going to come up later is about screen time and being online, and kids being online and spending their time online. And one of the resources in the toolbox is training provided by the Center for Online Safety. And it's live training and pre-recorded training on how to recognize the danger signs of too much screen time, how to make your child's devices safer, how to set them up, literally how to set them up and feel more comfortable about being online. And we know that that was something that people were asking for when we set up this Reset Toolbox. Another thing, I was in a meeting yesterday and they were talking about consumers were saying, we need tech support in order to access telehealth, in order to access online learning, all of these things. We need somebody who can help us navigate the tech support to be able to benefit from these things. And we've got guided technology support available at no cost to you there in the Reset Toolbox. So these aren't specifically mental health services that are available in Reset Toolbox, but they are resources that are designed to really help support the mental health needs that have come up as a result of this pandemic, which is what the Reset Toolbox was intended for. There's also intervention strategies for handling behavioral difficulties in the classroom, conflict resolution. There's training on, again, with grief, suicide prevention, restorative justice trainings, lots of things that have come up. And again, we've vetted all of these resources in the forms of online training, in-person training, live Zoom trainings, apps that are available that we've vetted and that are being created, and we'll keep putting them in there. So this is a place where if you just are looking for resources on your own time at no cost for you, it's easy to navigate, easy to sign up. There are places that say pre-register. If there isn't a class currently available, you know, within the next week or so, you pre-register and then they create the class as things come up. So it's really an amazing resource, again, that was created as a direct result of the mental health professionals in the community saying, what resources are these kids going to need in order to navigate their social emotional learning as a result, a direct impact of this pandemic.